Okay, we have two great guests on today. We are here with both Ariela Bickell and Erin Sengel to talk all about women's health and menopause. So I'm excited to jump into this. So we've got two specialists. We've got Erin Sengel. She is a board certified family nurse practitioner, subspecialty in lifestyle medicine. She uses an approach that uses nutrition, physical activity, stress management, sleep to treat, reverse, and also prevent chronic disease. She focuses on wellness, weight management, hormone health, and also in addition to her medical expertise, she also works with people through disordered eating, lifestyle and wellness coaching, and also is a certified fitness instructor. So she does it all from all different angles. And then we've got Ariela Bickell, who is one of our physical therapists at District Performance Physio. She's a women's health provider, pelvic floor provider, also loves working with runners as well. Definitely loves working with postpartum women, but also women through all stages of life. So welcome both Erin and Ariela.
Thanks for having
Thank you.
us.
Of course. So my job is just to moderate. This is for you two. But I always like to start. We love activity. Erin's a fitness instructor. Ariel and I help people exercise all the time. Erin, if there's one exercise you could do the rest of your life and only one, what would you pick?
Turkish get up.
Okay, love it. Ariella, what about you?
Is running an acceptable answer? I guess running.
I was going to be shocked if you said anything but running. Okay, so want to dive into menopause. There's, it's becoming more and more of a thing that people are talking about. But, if we broaden it to just hormonal imbalance, you guys work with a very similar population in different ways. So what are the major signs that a hormonal imbalance might be impacting someone's health?
With regards to entering the perimenopause transition, unfortunately, there's no one, and it would be really easy for us if there was just kind of this perfect algorithm of, all right, you hit this age, this starts here, you hit this age, this starts here. That'd be beautiful for us. But the other thing too is this transition is along the life timeline is also of a time when people are having kids, they're at higher responsibilities at work, they're in probably a long-term relationship, maybe they've housing issues, things like that, buying a new house, fixing the air conditioner, whatever it is. So it's also a time of high stress where symptoms such as like fatigue, brain fog, lower libido, something like that would also kind of play in this stage. Maybe not just due to perimenopause, but also of the fact of where you are in life. So it's really hard to suss it out. The other thing too is a lot of the symptoms of perimenopause they also parlay or they can mimic other diseases, whether it be something cardiac, whether it be something mental health wise, whether it be something of the endocrine system like thyroid, something like that. So it's hard to suss it out to say like this is perimenopause, and I think that's been an issue in the past, is that we would send these women to multiple specialists to address all these things when maybe the root cause of it was because of this declining estrogen or the volatility of the estrogen during this time.
Yeah, I agree. I mean, it's usually like a cascade of factors, and they also can be. There's also very plausible explanations for all of these things happening, which is what's challenging. But sometimes I kind of try to think like if something just like isn't adding up, and like things just keep like this pain after this pain after this pain after this issue and this. So that's it's kind of like if they have multiple of these factors and it just doesn't really making sense, that's when kind of start diving deeper into some of these questions.
Yeah, and usually, and so probably Ariella sees a lot more of the joint pain and stuff like that being in her line of work, and then usually by the time women come see me, it's either their friends are talking about it and they just don't feel like quote unquote themselves, but there's nothing like to hang their hat on. It's just kind of this milieu of symptoms or feelings that just they don't feel right, and then it's kind of doing the detective work.
So it almost sounds very broad and vague. Is that kind of a right way to put it, or that's what I'm hearing? But I want to make sure that that's like okay.
Yeah, it's very broad and vague. And then to Ariel's point, like if it's not making sense, if it's oh, it has to be my thyroid, it's got to be my thyroid, and then like those panels come back correct, or it has to be this, it has to be this, and that doesn't, it turns out it's not that or something. Or if it's like a new, like an acute onset, something like that, it's you can't just go right to it. You do have to kind of dot the I's, cross the T to make sure that there's nothing underlying or anything like that. You can't just say, oh, you are of X age, it must be this. There are times it's not that, or it's that plus something else. But yeah, to your point, it is very broad and vague, and which makes it difficult. And it also makes it easy to, for lack of a better term, like write off or be dismissed. This is a rite of passage, or this is just aging, or something like that. It's easy to chalk a lot of it up to just getting older.
I think that like this is why in history, like people are like, oh, it's just stress, or oh, it's got to be this, it's got to be that. And so that's when I kind of start like just digging into like, I mean, the main things I like, have you had any change in cycles? And that's when we can really get deep into it. And sometimes I'll be like, I'll ask somebody and they're like, I mean, like it used to be, maybe it's like a day or two shorter than it used to be. And I'm like, like, it's a small changes. And so that's really kind of how we can start to like decipher whether or not it's a hormonal thing. And then it's just a multitude of factors, but it's not super obvious, which is again why so many people get overlooked.
So then what are, you guys have both mentioned overlooked, dismissed. What are some of the symptoms or feelings people might have that might be overlooked or dismissed or brushed off that actually could be a hormonal imbalance?
What I see is a lot of times this like afternoon unwarranted amount of fatigue or tiredness. Also, women, we are very much characters of the multitask and no longer being able to do that as efficiently as before, if at all. And then also a lot, broadly speaking, a change in like personality almost, whether it's this new onset of like panic attacks or anxiety like I've never had before, or real feelings of being down. And again, we're not speaking to the person that has battled, depression since 18 or something like that. This is like new, and I use that word unwarranted because that also is like a clue. It's the acuteness, and it's not justified. That tunes you in, but that's what I get a lot of. I think in our culture we think menopause is a hot flash and that's it, and it's just a woman doing this and get on with your life. And so we're women, we're tough. We can get through that, but it's this, a lot of times it's this, I can't get through like I am now have to have a nap, or that like change in personality that can be quite frightening, alarming. And that's what I see a lot of.
Yeah, like all of a sudden they're like, I'm so angry at my partner all the time. Like,
yeah.
Like we're having so many fights. Like, I don't know what's going on. Like that kind of personality change as well. Like joint pain, of all sorts. It's just, this doesn't feel good. This doesn't feel good. Feeling just very weak in general. A lot of pelvic floor symptoms, like chronic UTIs keep coming in. Sleep disturbances, again, things that can be caused for many other things as well. But it's a lot. Those are some of the most common or like more obvious factors that you could see.
Again, kind of going back to, okay, you guys just mentioned a lot of different things, broad, vague. How does someone even go about figuring out, is this, actual hormone imbalance? Is it perimenopause? Is it something totally different? It sounds like it might be challenging to figure out where all of these things are coming from. Like Erin, like you mentioned, like sometimes it might be a life stressor, but it also might be hormonal imbalance. So how does someone even go about figuring this out?
So I just begin with like lowest hanging fruit. So if someone talks about their sleep disturbances or something like that, let's just start with your lifestyle. What's your sleep hygiene like? What are you doing before bed? Okay, if we can rule that out, now let's go into something else. If you complicate matters with the chronic UTIs, okay, that's putting some some, tally marks under the perimenopause. And then obviously the big one is like, what's your age? And so that automatically begins to narrow us in. And then, like Ariel mentioned, go into menstruation history. A lot of practitioners just say, are you still cycling? And the woman says yes. And, oh, let's move on with our life. It can't be that. It's one question further of like, has there been a change in your cycle length or the flow? And so having that, if they say, well, it's a day shorter, it's 2 days shorter. I mean, this is 1/100 of an inch a day is how this happens. It's not like you wake up and you're through it. And so just asking those questions, but I just start with lowest hanging fruit. And then, like I said, I kind of cross my T's, dot my I's, and, rule out if it's a cardiac, rule out if it's thyroid, rule out if it's, something else, and just kind of begin to level by level work my way down. But if I have a 20-year-old come in, I'm not going to be thinking perimenopause, unless, she had surgery or something, or chemo, but the first and foremost is the age. And then if they just kind of keep mentioning these things, you begin to kind of narrow in. I mean, it's just working your differential to narrow in on the cause.
Ariela, you obviously dealing more with like musculoskeletal issues typically, or like pelvic floor issues. How are you helping people determine whether they should be searching out further answers for hormone imbalance or hormone treatment?
Yeah, I think when it's like multiple of these things happening, and again, similar age, they're describing other things that are kind of lining up, and then I start to ask more about the cycling issues, and then I'll also just ask like, do you think it could be hormonal? Just kind of seeing what is going on in their life too. And I mean, that's also when I would when a lot of times they're like, you know what, I think it could be like, or even if they are still cycling normally, or they can't really think about it, because sometimes people aren't like really noticing these small changes that are happening. I would probably just send them over to Erin and be like, why don't you go talk to her and see what's going on? But yeah, it's really just the combination of factors, and then digging into what, like, really more specifically, like, could this be hormonal versus not? And the age and the cycling changes is the biggest thing.
You mentioned kind of briefly, are there specific either musculoskeletal conditions or pelvic floor conditions or symptoms that you're seeing more relate to hormone imbalances than others?
Yes. So when it comes to, especially for when it comes to like or menopause, in terms of for pelvic floor, just like pelvic pain in general, pain with sex and anything that kind of goes along with that, and chronic UTIs. And you'll actually see like physical changes to the area as well. And that's another way to kind of suss out why that could be happening. Lack of blood flow, increased dryness, things like that. And then also like, which now I think a lot more people are talking about, like frozen shoulder, plantar fasciitis, like those are also some things, but just in general, like back pain, neck pain, and it's just the kind of like the whack-a-mole of injuries that like this feels better, and now this starts to pop up, and then this starts to pop up, and then just generally like I just don't feel like good.
You both have mentioned age quite a few times. What age are we talking about?
So I would say like on average, like around mid-30s is when I would when my brain would kind of start keeping that as like a potential. The average age of when someone goes through menopause, which is 12 months since your last period, so it's a retroactive diagnosis, if you will, is almost 52 for white women in the US. And so, but symptoms can start, up to a decade before that. So you do the math, and if 50, almost 2 is the average, that means there's folks going through menopause at 47. So do the math backwards. That means at 37, they could begin having symptoms. So anywhere in there, around 35 is mid-30s, especially late 30s is when I begin to have that as kind of like a little, light bulb in the back of my head of like, this could be the beginnings of this transition. So definitely someone in their 40s, and then late 40s, early 50s for sure. But yeah, as soon as mid 30s is when I begin to kind of start thinking this.
And it's challenging because I mean you can still conceive during perimenopause. Like up until your very last cycle, you can still conceive. So it kind of like blends together, especially knowing like the DC area, like 30s and late 30s, early 40s, a lot of women are still having kids. So like that, those kind of changes in hormones, whether it's due to perimenopause or like because they're of child rearing age or going through that time, can kind of mix together. So it does get a little complicated, but yeah. Make sure people know that you can definitely still conceive during that time.
Yeah. And to Ariela's point, there is like, especially in this area where we're not in small town America, where you're done having children by 23. We are having them later, especially in our metropolitan, and so there is like this phenomenon now, and like more stuff being written. It's like from postpartum to perimenopause, like it's just this like whoa, right there. Also to that point, like the immediate postpartum is a mini menopause. The drop you get in estrogen immediately postpartum is a lot, and so like there is a transient menopause that women go through in the postpartum period, so they can see a lot of these issues too during that time. Theirs is transient, whereas the perimenopausal transition, I guess it is transient, just much longer until it comes to an eventual end. But so there are kind of these unique times in a woman's life that these hormonal shifts will happen, and they can have great presentations. So,
I mean, I'm by far the most ignorant person on this call, but it sounds like, I mean, if you say mid-30s, that seems like earlier than maybe we traditionally think of, like when changes start to happen. But again, I might be wrong about that. But is it much earlier than many people think?
Yeah, because I think too, like I said, in the zeitgeist, it was menopause was the hot flash, and mother was going through the change or something like that. And I think we conjure these visions of like older women, and then it's like put them out to pasture after that. Of course, also 30 years ago, I mean, you'd be in your recliner watching Price is Right, whereas now 40 is the new 20 and stuff. So I think too, it's wrapping your brain around that, because I would assume, several decades ago when women were quote unquote entering the change, they were probably in a stage of life where like stuff was getting calm and they were slowing down. Whereas I feel like now people feel at 40, speaking for myself, I feel like I am very much 20. So the idea that like this it doesn't match up with, for a lot of people, kind of their brain and their body. But yeah, it's definitely earlier than people think, because we always think it couldn't be me.
Or like I just had a baby, like I'm not going through perimenopause. And I think like there used to be nickname like there's nicknames for menopause, kind of like the death of sex, or like it's just like so like doom and gloom. And if you really think about it, like for many people, especially like with how long people live now, like you'll probably spend more of your life in postmenopausal state than you will in premenopausal. So it's not the end all be all, but like I think if you're in your 30s, it's not the crazy, especially like mid to late, it's not the craziest thing to say you're going through peri, because again, it's 10 years that you could be going through this, so it's a long time.
We definitely spend more of our timeline or lifeline in non-childbearing ages than we do in childbearing. But like there's, when we think of like the animal kingdom or things like this, like the purpose of females is obviously to reproduce, and so we're outliving like our biological purpose, and we're living much longer than our biological purpose. So that kind of, I don't know if we know why, but there is this idea that a woman's kind of done after it, which is not nice. It's not very fair.
So I usually like to tell stories to like help people understand. So for each of you, what's a story of someone that you've worked with either recently or like stands out in your mind that once they identified there was a hormonal issue, they actually got great results?
I have a patient, we did a podcast with her. Hers was, she still is. She does everything right. She's in her mid 40s. She still cycling. She lifts weights, 6 times a week. She, eats right, does very active, all of this stuff. And she was having, I must lay on the couch, just debilitating fatigue in the afternoon, and then a lot of brain fog. And then she was also having a lot of GU symptoms, like with painful penetration, a lot of UTIs, things like that. And so we started her on hormones, both systemic and local in the vagina. And that's the other thing, is your normal becomes your normal. And again, it's 1/100th of an inch of a day. And so once we started her, within 2-3 weeks, what she realized is she was no longer taking a nap. She didn't need the nap anymore. And then kind of like the executive function, that ability to multitask was coming back. And because she has 3 kids, and she was like, I could have a conversation with one at a time because I could not handle like multiple things coming at me, which was not her norm, and that had been setting in over the past 5 years. And so that was the most dramatic change that she felt, and she didn't realize how tired she was till she was no longer tired. And then all the executive function came back, and then also decreasing the amount of UTIs was huge. But because she had like pain with wiping, and that's all gone. And so that was dramatic change for her.
That's awesome. A
Yeah.
couple things there. I think like you said, like a lot of times when people are dealing with things, they just start to normalize and they don't even realize like how much something is impacting them until
Yeah.
that thing is actually better. And then it's like, whoa, my life is totally different now, even though I didn't even realize like how bad that was.
Yeah. Yeah. Yeah.
And then you mentioned you see like so people can see improvement even as quick as like 2-3 weeks.
Yeah, she was seeing, she had a lot of improvement with it. The other thing too, people see improvement with quite quickly is some of, like we were talking about, those personality changes, noticing that beginning to decrease, that the fatigue, the brain fog, those tend to change most quickly. And then also sleep disturbances, we can get those under control pretty quickly.
Ariela, what about you? Any good stories to share of someone who, once an issue was identified, like really saw good improvement?
Yeah, I had been seeing someone started off for pelvic floor and like chronic UTI and pelvic pain that has, she's had a history of, and she just finally was kind of getting around to dealing with it. And the time that I treated, we also working on her neck and then her back, and then her hamstring would start to pain, and then she'd have this pain and then this pain, which, we get a lot of those people, at District Performance, we get people who are coming for years of various things. But, in that time, we're also talking about, getting more stress, not sleeping as well, which of course is like related to other life factors. But finally, and it was really hard for her to find a practitioner who was just knowledgeable about the perimenopause phase. And we had also been talking about pregnancy, and she was like, oh, when I was pregnant, I felt amazing. Like I like loved pregnancy. I felt awesome, actually, which is also like, oh, like when you have that high estrogen level, like her body does well with. And interesting that all of these things are happening when they start to scale down. And I think it was really she said she's got diagnosed with osteopenia, and that she really should start working on more strength training. So then we kind of shifted to that, and that's what allowed her to really go see what's going on with her hormones. And she started getting hormone replacement therapy, and it's changed her life. She's like all of this random pain that she kept having, like, gone. I mean, things are still bothering her, but just not to the same extent as it was. And she's like, I'm not fighting with my husband anymore. And she has all this energy, and she's like, I'm lifting weights. Like, I'm lifting more weights than I ever have. And like, she's like, I'm feeling so strong. Like, can you believe it? And I'm like, yeah, I can believe it, but I'm glad that you do too. Like, so it was pretty cool. And now she's just like telling everybody she knows about, like, make sure that you get this checked up on, because it was life-changing for her.
That's awesome. Did either of those, either Erin or Ariela, did either of your patients, have to kind of go through a lot of different medical providers? Like, how did they navigate, like we talked about, broad, vague, did they have to navigate like the healthcare system at all?
I think in general, a lot of times, women, we tend to think like this is kind of our lot in life, and we kind of just push through things. And we're like these mythical creatures that have cycles and things like that. So I feel like a lot of times people love to chalk stuff up to that, or practitioners do. And so, yes, so I've had the patients that they've gone to their GYN, and they've been told, we'll see you when you're done cycling. Oh, you're still cycling. We won't see you. So you can't be in menopause or perimenopause. Or I have the patients that by their PCP have been referred to a mental health provider, have been referred to cardiology for new onset of heart palpitations, have been referred to uro for new onset of overactive bladder or nocturia or something, and then they have been referred here, and so I do have those ones who either one, they say, well, this is to be expected during this time, just kind of buckle up, and offering nothing, or they tell them to come back, or they refer them out. And so that's, they and then at that point you're just like, oh, I'm done with it, like, whatever, my mom dealt with this, Susie down the street deals with this, like, I'm not going to all these appointments just to be told like this is to be expected. And so they kind of run the gamut, and it also is just wearing too, to be dismissed kind of again, or not offered education, information, solutions, possibilities, anything like that. I think they do just kind of, so a lot of like what we're doing here is just trying to put out information on like, here's the common phrases you've probably heard from your PCP or someone else, and here's why that's not the best way to handle it, or here's the alternative, or here's what how they should have responded, because it's a long road.
Yeah, I think like I don't remember the exact like numbers or details, but like there's studies that show like that majority of like OBGYNs like don't feel comfortable, like they've had such minimal training in this cohort, or in that section, and they don't feel comfortable having these discussions with perimenopausal women, like, and it's not their fault. I mean, there's so much to learn, but it's just crazy that like even then, like during their training, they're left feeling like they don't know what to do. So it is really hard finding people who are more knowledgeable about this subject so you can help guide people, because yes, like while it is something that you go through, that perimenopausal period, it's super important to identify, because that is the time when making the most change, you can make the most changes and set you up for better success. And that's what people don't realize. Like, yes, of course you're going to go through menopause. This isn't preventing that, but it's just to help you during that transition. And like, this is the perimenopausal time is the time to do that.
Personally, I got blood work from my PCP, tested for testosterone, was told, oh, you're totally fine. You're normal. You're in normal ranges, I was told. And then went to another provider and was like, sure, technically you're in normal ranges, but there's still some things to do. I went on hormone replacement therapy and I feel totally different. Whereas I could have just said, oh, my PCP said my blood work was fine. So I'm sure people get fine blood in quotes, blood work all the time. How does someone know like when to go the next step and not accept that their blood work was fine? That seems like a hard to know when it actually is fine and when it's not.
Yeah, and we have, like, we do have some labs that have a very narrow acceptable range, and outside of that can be not catastrophic, but have more dramatic effects. And so we do have to play very nicely in that. And then we have other labs that have a giant range, and anything within that is still quote unquote normal, but it can present very differently in different people. So I don't think it's incumbent on the layperson or the patient to know like when my labs are quote unquote normal, when to make the next step. I think the conversation is, I'm symptomatic, so regardless of my labs, like something is here, something needs to be addressed. That's what we're addressing, is the symptoms, while keeping the patient safe. And unfortunately, that's just a lack of education or the educational system on our providers that haven't touched on that, and that's kind of a very archaic thought process that we just treat numbers. And I mean, I feel like anyone worth any medical salt, like the thing that's always shouted at us is like, treat the patient, not the machine, or treat the patient, not the number, And so, but then when it comes to labs, like we like to fall back on that. We feel very safe within those labs. The other thing we have to know is like there's statistical errors and there's all these other things. So, but so to your question, I don't think it's the patient. I think it's knowing that it's being able to advocate for yourself, which I know is very challenging, because as a layperson, as the patient, you expect this person you're going to be there in your best interest, and to be the one that's rallying for you, and they are, and they should. But ultimately we have to like be our own advocate and stand up for us. So even if your labs are coming back normal, advocating for yourself and saying that, but still there is that I would like to address, and having that conversation. I guess ultimately, to answer your question, if you're seeing a provider and you don't feel heard, seen, cared for, then find a new provider would be my suggestion. But it's the same thing like in Ariel's like wheelhouse. I mean, how long has that been the narrative that ipso facto, you have a baby, you will pee yourself for the rest of your life. You will never laugh again. You will never jump. You will never do anything unless you want to pee yourself, And so like that's been our narrative for I don't know how many decades, which is crazy. And there's still people that very much believe that and think like I chose to have a child, I accepted this outcome. When we have interventions readily available to us, I mean, also that's a disservice that there's no way I'm leaving the hospital after a total knee without a script for PT, but we'll leave the hospital with a baby and there's no script for pelvic floor physical therapy, but that's another discussion. But it's fighting that narrative of what's been sold to us as just kind of, this is to be expected in exchange for getting older. This is your compromise. And so it's fighting that narrative and letting people know that there is help, there are resources, there are options, there are solutions.
Yeah, I think just like, people always just like, you just learn to live with it. And it's like, you don't always have to just learn to live with it. If you're miserable, or you don't want to live life like that, there's lots of things that you can do. But yeah, I mean, I agree with everything that Erin said. And yeah, labs are for a lot, like during this time, it's a snapshot in time, and hormones are like, go haywire. So it is really hard, but it's okay to like, you should have someone who's listening to you via like symptoms is enough. If you're having all of these symptoms, like that could be enough to do something about it without having to have that numerical value. As everybody's different, and there's not like a one size all for treatment as well. So there's many different ways to go about it. If one thing's not working for you, try something else. So same thing, like if you're not feeling heard, then like whether or not it's because of your labs or not, just like make sure you are getting some answers.
You guys have mentioned treatment a lot. I want to dive into treatment on a separate episode with you, but I think my next question you guys might have just already touched on. If there was one thing you wanted people to kind of take away or do or think about, I don't want to put words in your mouth, so I'll let you answer. Like if there's one thing you wanted people who are listening to like start doing or take away or do tomorrow, what would that be?
I mean, I think like just knowing the symptoms and not settling for just dealing with it. Just knowing that there's things that you can do and that it might not be obvious to you if you're going through it, but like it's important to acknowledge it. And if you are not feeling good in your body, to do something about it.
It's not too much to ask to demand to feel better or expect to, like this idea, again, going back to this like narrative we get sold of like, just wait till you're 30, just wait till you're 40. Like it's such crap. A desire to feel better as you age or to feel as you were. And that doesn't mean that you might necessarily like, I mean, I'm never gonna have the skin of a 6-year-old, but like the idea that like I can do things to and continue to thrive and be better and feel great as I age, like that's not selfish, and nor should I feel like crazy for wanting that. So I guess that's it. It's just like, don't settle.
All right, this has been awesome, you two. I do want to get you two back, and I want to talk much more about what treatment options people have. But this has been fantastic for people to just understand what might be able to be helped, advocate for themselves. So I really appreciate you two being on. Erin, if people want to find out more about your approach and how you can help people, where can people find you?
I work out Vitalify Med Spa in 1 DuPont Circle on Instagram or on our website, just vitalifymedspa.com, and book a consult with me. I'd love to speak with you.
Fantastic. Ariela, where can people find out more about pelvic floor therapy, women's health, physical therapy, more about you?
Yes, you can find me at District Performance Physio, so districtperformancephysio.com. We have women's health providers at all the locations. I'm at downtown, but we have many people here for resources.
Awesome. Thank you both, and can't wait to have you on to talk more about treatment options. Thank you.
Thank you.
Can't wait.